It feels wonderful to say that people with Down syndrome are living longer, healthier lives, but those longer lives bring on their own unique complications. Good morning. It is Friday, February 16th. I'm Jessica Lovell, and welcome to the Morning Medical Update. Today, we meet an expert who has dedicated her own life to making life better for adults with Down syndrome. We'll ask what's improved. We'll meet with two of her patients and learn about the fight for more progress that is still ongoing. But first, in our morning rounds today, child psychologist Dr. Danielle Johnson is here to help us understand the concerning new report from the CDC this week. Teenage girls are reporting a record high level of sadness and hopelessness. More than 17,000 U.S. high schoolers answered a CDC survey. 57% of girls said they felt persistent sadness, up from 36% in 2011. 30% of girls said they seriously considered suicide, up from 19%. Meantime, rates for boys stayed pretty consistent. So, Dr. Johnson, are we able to tell why rates for girls have gotten worse?
So that's a great question, Jess. And this study looks over the last 10 years. And if you look at the data, each year it goes up incrementally. So we've got a pretty significant increase over the last 10 years. The data reports the information, does not tell us why. So it's up to us to kind of postulate what may be adding to the increase in these numbers. And we can think of this generation is one of the first generations that grew up with one of these with them at every waking moment. They've grown up with an iPad, a tablet, a phone at their disposal, and they have access to so much more. And I think that that is part of those numbers, that we have an ability to see news and media and things from across the world that people of our generation did not have that access to until we're much older. And what do you do with that information once you receive it? And for many kids, they don't know what to do with it. And for parents don't necessarily know what their kids are always looking at when they're on a screen or what they're talking about with friends on social media. That we are, as parents, aren't intervening because we don't know to intervene at all the times.
So what do you hear with your patients about sadness, helplessness? Any insight from what you're personally hearing?
Yeah, I see a number of teenage girls, and that is a prominent theme of sadness. It's a prominent theme of hopelessness. And I have a couple of females I can think of in particular. They talk about kind of, why do I go to college? Why do I do all these things? Kind of these esoteric crises of, what is the point of all this when they think about climate change, when they think about race and cultural relations, when they think about LGBTQ issues? And I've got a handful of females who are LGBTQ, and they wonder about their safety. They wonder about how they can be in this world in an open fashion and be safe. And so I think we've got a number of racial demographics that we've seen the racial awakening and the understanding of Black Lives Matter, for instance. If we look at the Middle East and some of the things happening in the Middle East, that our females seem to be more vulnerable because they are at risk of being assaulted or having more violence. And that study also talked about the increase in violence against females as well. And so if you have some awareness of what could happen to you, that would increase your sadness, your hopelessness, your level of anxiety of what could go wrong, because you see a lot of reminders of what could go wrong as a female.
Dr. Johnson, full disclosure, you and I are kind of on a first name basis. Well, we are, because we have daughters. Yes. We have kids that are in the same age group. So I always have a lot of questions for you. Yeah. And you're right. We're going through this together, raising kids on these devices. It's very tough. And really, quite honestly, it's scary. So how do parents talk to their kids about this?
Having an open and honest conversation is age appropriate is number one. So making sure you're tailoring your questions to your child's age, but also being open. I think we often use kind of code words or keywords that don't really ask the question. I tell my parents, if you have concerns about your kid's safety, you ask them, do you feel like dying? We often don't use the word dying or death or killing themselves because we fear we might implant that into their heads. If your kid's struggling, they're already thinking about it. You're not implanting anything. You're in fact opening the doors to having an honest conversation because they understand that you understand they're struggling with. I encourage parents to have monitoring devices on kids' electronics. So make sure you know how to access any social media they have, that you have all their passwords, that your kids know as a parent you have the right, and you will look at their social media because you want to make sure they're safe. It's about being safe. And so parents talking to your kids about being safe and all the things you will do to help keep them safe for their protection and their safety. And so with that, your kids aren't surprised when you say, can I see your device real quick? And let me just see what you've been talking about and what you've been doing. And having a conversation so they then know if there's ever a concern, you're there for them, you can come to them and have open conversations.
Yeah, stick your nose in their business all day long. Just lastly real quick, are schools doing enough? What role do they play?
You know, and the study talks about schools, and to be honest, our kids spend the bulk majority of their waking hours at school. That's where they have their face-to-face social interactions. They get home and get on devices, but their face-to-face interactions, majority are happening at school. So schools have a role because they have our children there for 6 to 8 hours of the day. And so I know some schools are doing innovative things with providing therapy in school from an outside counselor. They're having programming to make sure that kids have a safe place to go. And so collaborating with your child's school to help offer support, I think, is vitally important because, again, our kids are at school most of the waking time that they're awake. They're at school.
They're there. They're either there or here. All right, my friend, Dr. Johnson, always good to see you. Thank you so much.
A pleasure. Take care.
You too. All right, let's turn to our guest today. Dr. Moya Peterson is a family nurse practitioner, a nationally recognized expert in caring for patients with Down syndrome, and the founder of the Adults with Down Syndrome Specialty Clinic here at the University of Kansas Health System. Alongside her is Lucy Wagner, a patient and one of our co-workers here at the health system. How are you both doing today?
Fine, thank you.
Good to see you. Lucy, great to see you.
Great to see you.
Yes, yes. And also joining us live is another one of our colleagues, Rachel Mast, along with her mother, Joanda. How are you ladies doing today?
Great.
Good to see you. Good to see you
Hi.
both. All right. Hi. Hey, what's going on? All right, Dr. Peterson, I want to start with you. Been a lot of progress over the decades, as we know. Public awareness and acceptance, that's one thing. But outside of that, the medical knowledge has advanced. How far have we come in terms of life expectancy?
Well, right now the current life expectancy is 61 of an average adult with Down syndrome. But in 1985, which when you get to be my age, that wasn't so very long ago, that life expectancy was only 25. And so we have made a lot of progress in knowing how to handle their heart problems, knowing how to handle various and sundry disease, but we have a long ways to go yet. But we're learning a lot. So it's a relatively new phenomenon in medicine that these guys are living beyond the pediatrician's years. And so now we have to learn how to deal with them as adults.
Right. So what unique health care needs for adults with Down syndrome are there?
Well, now we're learning what it is to live with a congenital heart disease. They have a lot of autoimmune disorders, and so they have to learn how to live with celiac and rheumatoid arthritis and maybe diabetes, hypothyroidism. So those are things that we have to always take into consideration.
So you mentioned it. It's kind of uncharted territory and very exciting. I know you're learning a lot still, but what's exciting you about the future, and what kind of information you're gathering, and where you think it's going to take us?
Well, you know, they used to tell the parents, just take them home; they'll never be able to do anything. And we're finding out now these guys are wonderful guys. They are loving, wonderful guys, and they want to have homes, and they want to have significant others, and they want to have college, and they want to have everything, a job, everything everybody else does. And it's just exciting to watch as we're able to facilitate that and keep them healthy so they can do all of those things.
And fair to say, you get pretty personally connected to the patients and their families. Tell me a little bit about that.
Oh, I love them. I met the first young man I met with Down syndrome was when I was a senior in college, and we just clicked. And it's something that I've always just identified with them, and I kind of get them. And so I work
we see these moments here on screen. I think that really says it all. No words have to be said with that.
That's one of my favorite times. Those are special moments when they put their head on my head when I'm listening to them, or they hold my hand, or they hug me. That makes my day, and I know what they're telling me is that they trust me, and that they know that I care about them and want the very best for them.
They do. Let's bring in Rachel on that note. Rachel, what do you like most about Dr. Peterson?
So I really like about her is that she is so caring about my health, and that she just loves being happy all the time, and that she's just a great nurse, and she shows me great health, and she's so respectful of my time and how much she just loves me for time. She gives me some time to talk with her. Like even I'm ups or downs, she will always gonna be there. She always will talk to me about some things, about like some good talks, and she's outgoing. She's up awesome. She's on the stage, and she's just her beautiful smile. She got a great smile. That's what I love about her, is because her smile. It's because she has a great smile, a great outfit she wears every morning. If it has great hair in the morning.
I love it. You've got great smile, great style. Great style, great smile, great hair. This is like how I describe my best friend, Rachel. So I think you've described like a best friend. I think that's fantastic. Jawanda, same question to you. What does Dr. Peterson mean to you and your family?
Well, we're very excited that we live in a community where we have an adult Down syndrome clinic, because there aren't very many adult Down syndrome clinics. And I've known about Dr. Peterson for years before Rachel even started coming seeing her, and met her at national meetings. And it's just reassuring to us to have someone who is an expert on Down syndrome to help us guide our health care into this unknown, because as Dr. Peterson said, these adult years are a bit of an unknown and new charted territory for all of us.
Rachel, we talked with one of your bosses, LeMay Dennis. She said she loves working with you. We talked with her. Let's listen in.
Some days it gets a little hectic, but like when Rachel's here and she's really in a good mood, she'll dance, and it kind of breaks the monotony. It makes us have a good time up here.
So Rachel, tell us what you love most about greeting our patients as they walk through the door. I'm sure they love seeing your face.
Well, I love being outside because, of course, people can see me up there. I mean, if you see me on TV right now, that's what I've been doing. Is to stand and to see people coming in. And that's what you just saw is a morning routine. You wake up, you get up there, and you go and shine on the stage. I'm so happy that I'm able to be dancing and doing this. It's the best part of the day. If she's here today, if you see her today, she would know that I'm high energy. Right now, I'm high energy. I'm up, I'm high energy. I'm just so happy to be here. If you see me on TV, it's that I love to be acting and singing on the stage. And that's part of, you're gonna see more of me tomorrow. I'll be modeling and stuff, and how much I care about my health, and I love being over TV.
Rachel, you just explained why we hired you to be a greeter at our health system. We have found the perfect job just for you, because you're the first person people see when they come here. Not everybody likes coming to a hospital, as you well know. So to have you there greeting people, we thank you for that. So your boss said that you like to dance. We just saw some of your moves. What else do you like to do with your free time?
So that's a great question. I've been waiting for this day. So besides dancing, I love acting and singing on the stage. And also, I love being with friends. My friendship, even my friends are here, I love being with friends to go out, just being, because I don't drive. I have friends, and I go out to eat. I love going to plays. I love going to parties. I got for some cars too. I love going to parties, some formals and sorority parties, and going to see movies and plays, and watching TV. And of course, I love watching TV, but also it's not about being on TV. It's I love being with friends and go see movies and be able to hang out and just have some fun.
Rachel, you sound like my kind of girl. Watching TV, hanging out with friends, going out to eat. Love doing all that. Let's bring in your friend,
Thank
Lucy. Lucy, what do you like to do with your free time?
Well, hi, Rachel. I love dancing.
I heard.
And let's see, what else? Oh, I'm obsessed with Dancing with the Stars.
Dance with the Stars. Love Dancing with the Stars. I love this.
Yes. Because I do a lot of Dancing with the Stars things on my computer.
Okay, tell us what we're looking at right here. What is this? This is amazing.
It's me trying to learn the Argentine tango.
Argentine tango. Okay. I don't know if you're trying. You're doing a pretty darn good job here. I love this. So you take dance.
I was nervous on that camera.
I know. We brought our camera out. Got you during your full session with your teacher here, doing an amazing job. I know. I knew you loved it. Look at you. I love this. You also love Travis Kelce. I told you he's going to be.
do.
So he's hosting Saturday Night Live next Saturday. Are you watching? I'll be watching with you.
I hope so.
Yes.
It'd be really fun to watch.
We've got to watch this. Okay, so I want to talk to you a little bit more, Dr. Peterson. Well, let's get to some time with Dr. Hawkinson really quick, if we can. And send in your questions for us. If you have questions, go to YouTube, Facebook, or the Medical News Network. Let's get a check with our COVID count. Good morning. How are you?
Hi.
Hi.
The dancing looked good.
I know,
Probably
right?
a lot better than me trying to floss or do the lawnmower or whatever. So.
Yeah. We'll try that later. It is
really
Friday,
good,
but
though.
let's lock it up.
You
okay?
didn't look nervous at all. Right now, active cases are holding steady at 27. We've had that high 20s, mid 20s. Overall, 53 total cases, but the active cases, 27 active cases. Unfortunately, we have seen an increase in our ICU admissions. 8 in the ICU and 4 on the ventilator. And if you look at the recent data, particularly with the New York Times data, it does show that the vast majority of the hospitalizations are those people over 70 years old. The second category is those in the 60 to 69 age range too. So obviously this disease continues to affect our most vulnerable populations.
It sure does. All right, Doc Hawk, need to get a thought from you on a headline regarding the future of flu vaccines using the same mRNA technology that we've seen in the COVID vaccine. As reported in the journal Science, scientists created a universal flu vaccine that fights all known subtypes of flu A and flu B. We should point out that this study was in mice and ferrets, but so we don't know if it works in humans yet. But as things stand now, doctors have to predict which flu strain will be dominant during the next flu season. We don't know. So would this mRNA vaccine solve that particular problem?
It's one step closer to that, yes, in this particular study, just as you said. So this is a very early study done in the mice. It's a very good model for going on to the next steps of this, but it is very important. They took the antigens, basically the hemagglutinin, from 20 different influenza viruses that we have been seeing recently throughout the years, and we're able to all package those into one little nanoparticle essentially and deliver that as a vaccine. So instead of getting, say, 4 strains like you get in the current influenza vaccines, of which they also have to figure out which one do we think is going to be circulating during influenza season. That has to be done 6 months before. This would help negate that and really just create that cross protection so that there is that so-called universal influenza vaccine to help protect against many different strains, not having to really necessarily deal with what is the particular one we predict will be circulating at the time. So it is a very good step forward, and we still don't understand, how many different flu strains can we put into this vaccine. So right now in this study they use 20, but maybe we can use more. So I think it is very exciting. We know this mRNA technology for vaccines has been very good for COVID-19, and now we are putting it into other vaccines as well, and this is a good first step.
All right. Dr. Hawkinson, thank you so much. So I want to ask you, Lucy, I see you working down when I go down to get my lunch. Tell folks what you do here at the health system.
Well, I am a dining room host, so I'm out cleaning tables, stocking silverware, condiments, yeah.
Well, here you are, back here getting all the stuff, stacking our place. I love the D&G Cafe. It's so nice. I have to admit, I was telling your mom, you work hard, but I do see you visiting with people and you work the room, which I love, talking with folks and just really like enhancing their experience when they go down to get their lunch. So, and you work hard, and we appreciate that. I love this. I love this video. When we first met, though, Do you remember me from when we first met?
I think so.
Okay, so I told you that for when I first started here, I was like, why is there no ice cream? Why is there no ice cream in this hospital? Like, there's something about having an ice cream in a hospital that I love. And then you show up, right?
Yes.
From where you worked before, and you brought your ice cream over. Tell us about
Yes.
that and where you worked before, and that there's an ice cream named after you that you can get here at the hospital.
Yeah, there is. Okay, so the Golden Scoop had an opportunity to sell ice cream at the University of Kansas Health System, and I was there when I got to deliver the first 500 scoops of ice cream.
And I had several of them. I did.
Yeah.
Tell them about your flavor.
So my flavor is Lucy's 41, and it's a dairy-free vanilla ice cream. You can find it in the Heart Center and at the D&G on 39th in the Cambridge building.
Okay, these are important questions. People need to know where to find the ice cream here at the hospital. So
Yes.
thank you for bringing that
You're
over.
welcome.
And I love your flavor. What do you love so much about Dr. Peterson?
Oh, I love her.
Tell me all about it.
Well, she likes up when she walks into the exam room, she just lights up the room.
Who does that?
I don't know.
I want to know where your passion for treating adults and folks with Down syndrome came from.
I honestly, I don't know. I met this young man when I was a senior in his day services, and I clicked, and there's just something about these guys that just tugs at my heartstrings. I think the other thing is special needs. I just feel drawn to them because they haven't always been given the best of care, in the past, and I just wanted to provide the very best that we could for them.
And you're doing that. How did the adults with DS specialty clinics start?
When I completed my dissertation in 2006, it was with adults with Down syndrome and their health care needs, and I found out there was no clinic in the Midwest. The nearest ones there's one in Chicago that doesn't take anybody outside Illinois because it's been there a very long time. Mm-hmm. And then there's one that it was struggling at the time, but is better now in Denver. And there's really no specialty clinic. We have a real good one over at Children's Mercy for Kids, but there was no specialty health care for adults in the Midwest.
Yeah, fulfilling that healthcare need that is evolving.
Yeah, and I felt like KU was the place to do
Love
that.
the work you're doing. Joanda, I heard that you're involved in a lot of advocacy when it comes to Down syndrome in our community. Tell us a little bit about that.
Well, we had a prenatal diagnosis with Rachel, so before she was even born, I started hearing about outdated laws that make no sense, like being unable to save money and all those kind of things. And I've always kind of liked advocacy and had done a little bit of it before Rachel was born, so when she was born, I really jumped into that. And I worked myself into a job as the manager of grassroots advocacy for the National Down Syndrome Congress. And I work with people across the country in their states, but also on the federal level, to help get policies that are good for people with Down syndrome. I have worked outside of my job and helping teach people how to be advocates. And really what we try to teach people is learn to tell your story. And if you can tell your story to leaders and influencers, you can use it to make a difference. And that's what Rachel and I have done. Rachel and I worked for 8 years on a law called the ABLE Act, Achieving a Better Life Experience, for the first time, and it was passed. It took us 8 years, but it passed. And what it does is it allows people with Down syndrome and other disabilities to have a way to save some of the money they earn without losing their benefits. But it's a really small step. Rachel got to open the first Kansas ABLE account, which was great, and she's over here cheering about it. She's very proud that she can earn money and save money, but that's something that's still still really a difficult thing because of some of the limits, like on Social Security and your earnings. It makes it very hard for people with disabilities to dig their way out of poverty. And we know that people who live in poverty, that they do not that they have a harder time accessing health care. So all of these things influence the other things. I was telling them when we were walking through the hospital to come up to this show, we passed the transplant area. Just a few years ago, we passed organ transplant non-discrimination legislation here in Kansas. I believe there are 34 states that have passed it. People don't realize that oftentimes people with Down syndrome and sometimes other intellectual disabilities are passed over for organ transplant, and it's not something that's really it's not necessarily intentional. It's that we don't think about the fact that this person could manage the aftercare of a transplant with a circle of support. And really, don't we all need a circle of support? Of course we do. So it's just making us all get on an even playing field. Some of the other legislation we've worked on in Kansas had to do with seclusion and restraint in the school system. Individuals with intellectual disabilities and minorities are disproportionately secluded and restrained, and there have been injuries and deaths, not deaths in Kansas, but in the U.S. And so that's another thing that we are working on. The last thing I'll mention, because I could talk about this all day, is we're working to pass legislation that will help people with Down syndrome and other intellectual disabilities not be discriminated against when it comes to being paid to work. It is still legal to get something called a 14C certificate and pay people with disabilities less than minimum wage. And that's really a disrespectful and outdated way of treating people with disabilities. And we have seen so much success with people with disabilities that we move into competitive integrated employment. And you can make it work. So we work together with families and legislators and people and hospitals and anybody that will work with us to try to pass a good policy.
Joanna, I'm happy to give you the floor on that, because I think it's one thing to identify problems, but to hear the solutions that are actually in place and the steps that are being taken, it's very encouraging to hear that people are there fighting the fight. So thank you for that. 8 years is a long time to be fighting for that legislation, so thank you for your work. A couple more quick questions. Dr. Peterson, how do you determine if someone with Down syndrome can live independently?
Well, I think it really is up to the family. They have to make that decision together with the adult. Can they do independent things? Can they take care of their laundry? Can they cook? Can they get to work? Can they pay their bills? What kind of support are they going to need? Those are all decisions that have to be made along, and the family has to make those decisions in general.
Lucy, you're working, you're living life independently. Anything that you're looking forward to doing as life progresses?
Well, I think in the future, I would love to be a professional dancer on Dancing with the Stars and travel the world and dance and make people happy.
I love that. I love that. Joanda, question for you. Are you hopeful with Rachel's future, or do you have concerns? What worries you? What excites you and what worries you?
We're hopeful. I mean, Rachel has so many opportunities that people more before her did not have.
Your attention, please. This is a test. Have you ever had paging system? This is a test. System.
We are very hopeful for her future. You know, we talked about some of the legislation we've passed for her, but it's passed for other people too. I would not say that we worry about Rachel's future, but we do have to have things in place, different things in place that other families have. We have to make sure we have things set up. As Dr. Peterson said, used to people with Down syndrome live 25 years. Now they're living 60 plus. So they're outliving their family members. So there's a caregiver crisis. So that's something we're concerned about. But I am hopeful because I do think that we have some great supports in place. Rachel's ability to save some money. Rachel's famous for saying that she told our Senator Moran the first time she met him that he needed to sponsor the ABLE Act so she could live in a pink house. That caught on across the country, and people are still sending us pictures of Rachel's pink house. But that gives me hope. It gives me hope that we have so many more options now than people used to have. But we do have things that we have to put in place to make sure. Rachel would tell you, I'm not telling any secrets, that managing money is very hard for her. So she really looks to me to help her with that. See, she said that's true. Money's very hard for her. There are other things that are hard. But you know, we all have hard things, and we figure out how to find supports to do those. Hers just look a little different than that.
Let's check and see if we have any reporter questions on the line. Let's get to our community questions. We've got a few, and I'll start with Jeremy. Jeremy wants to know, Lucy, what's the part of your workday you look forward to the most?
Going to lunch.
Yeah, right?
Yeah.
Truth be told, that's kind of my favorite part too.
Yeah.
So
I have
that's
two favorite days that I get my lunch here at the hospital. At the D&G, they usually have Taco Tuesdays, and then they have Wing Wednesday.
Wing Wednesday is spot on. Our whole crew is like raising of the roof right there. they're fist bumping for Wing Wednesday because the food over there is amazing. We love walking over there for that. Question: what was school like for Rachel and Lucy? Lucy, I'll let you start.
Okay. I was treated. In elementary, I had a lot of troubles with teachers in the past, but I remember that I got a lot of good things come out of my elementary.
Good.
When I got into middle school and high school, I was like in regular general education classes, where other kids with Down syndrome don't. Because they get put in different classrooms to learn their different stuff. So it is really important for people with Down syndrome to be able to take general education classes so you can be with like typical friends.
Yes, I remember growing up in elementary school. The kids would be in one, nobody was integrated together. It drove me crazy. So that is one thing that stands out to me is when my kids come home and say that they are in the same class with kids that have different abilities than them. I'm like, yes, that is a major win. Do you not agree?
No, that's true. But I think as important, not more, maybe as more important, but as important too is not only to involve them in school, but to encourage your typical kids to ask them out for other stuff and be a friend. You know, to be in a class is one thing, but to befriend them after school, you know, invite them to a party or invite them to go out with a couple friends to a movie or to a restaurant. That's really important because just because they're in the classroom doesn't mean that they're socially connecting and making friends, and I think that's incredibly important for my guys.
So it's not just enough, thank you, you're teaching me right now, it's not just enough for them to befriend at school or sit together at lunch. We need to do more.
Yeah.
All right.
And just, give them a call, even just to talk to them on the phone at night and say, hey, what's happening, like you do all your other friends.
So glad you said that. Okay, we're on it. We'll do that. Couple more questions, and Lacey has a question, and I'll ask Rachel. But what advice would you have for maybe we were talking about being back in school, but maybe younger kids back in the day when you guys were in school that might have to deal with people like a bully or someone who says things that aren't very nice? Rachel, that's for you. What are your thoughts?
Okay, thank you. So my thoughts is that back in my day, I make some friends who is nicer to people, and it hurts me because I see people who bullied a lot in my high school, and it's not nice. What I do is have a big group of people who support you and make friends who support you, who loves you and support you, and it made me think it's really sad. If you see someone do that to you, it's not nice. And friendship is more important. It's that you need friends who will treat you the way they want to be treated. And what I would say is that do not use the R word. It's not nice. It's not nice to use that. Even though it's not nice. But please respect people if they want to be treated. My golden rule is to treat others that they want to be treated. And please treat them if they want to be treated. Even at workspace or with or without Down syndrome, we need more respectful. And some people, I'm a self-advocate, and I also do self-advocacy. Also, I want to step up make some friends. You need to be out there and get up there and get some friends who is trustworthy. And also, my other thought is to act and trusting adults. If I get bullied, I come to my parents. That's what I would do if I was you. If I go to school like that, I'm not going to treat like that. It hurts me. It breaks my heart. And I was putting this more later on, but I love making friends. Yes.
Rachel, thank you for saying that. Lucy, I want to give you a chance to share your advice.
Okay. Being in high school when I was a junior, I remembered that I got hurt by someone that had autism because I was physically hurt. I had a major track burns on my arms, and today those bullies just made me stronger.
I love that. They make you stronger.
Yeah.
Yeah. Your bullies aren't sitting here on TV sharing their story and living a great life. I appreciate that so much. Thank you.
And I think that's why it's important to have friends.
Yes.
Those, if I would see somebody bullying, I would step up if I was her friend.
Absolutely.
And so that's another reason to have friends, just not classmates.
And you are, exactly, not just classmates. I really love that. I hope other people, that resonated with people the way it resonated with me. It's not enough to just be in the class and be nice. It's more than that. And you're like their best friend. You're one of their many best friends.
I hope so. I hope so. I hope they feel comfortable, telling me what's going on in their lives and what they want from life. And when I ask them, how are you doing? I mean, I talk to them and how are you doing? And do you have any concerns, that they're open enough to say, yeah, I do. I do have this concern, and we talk about it.
Lucy and Rachel, thank you for those wonderful final thoughts. We hear you, we see you. Jawanda, your final thoughts today.
Well, I want to thank you for the opportunity to be on, because I think it's always great when we can educate people. And you admitted just now, that you learned something. We all learn something every day. But it's just been a great opportunity to be on and talk about this. I do want to say one more thing about the inclusion and the friends. I echo everything Dr. Peterson, Lucy, and Rachel said. And, Dr. Peterson hit it on the head when she said it's not just enough to have our children in classrooms, that they need to be included in other ways. But I also believe, and I think research supports this, that when our children with disabilities are in classrooms with people who don't have disabilities, and when they work and play together in school and in the workplace, they are going to, like you said, be the people that are going to stand up. They're going to be the cheerleaders for Rachel and Lucy and stand up to the bullies when mom, dad, Dr. Peterson, or another adult's not around. So inclusion is a really important concept.
Thank you so much, all of these guests, for your words and your thoughts. And Dr. Peterson, I want to get your final thoughts. And before you get to those, would you tell us where someone can get in touch with the Adults with Down Syndrome Clinic?
Sure. I'm very grateful to the people that let me start this clinic in the Department of Family Medicine. They were very supportive, and there's a stat that I read that 38% of all Americans know someone with Down syndrome. So that's over a third of our population. So I was grateful that the clinic was supportive. So if you need to get in contact with us, you can call the Department of Family Medicine and Community Health, and they can get you in contact, or you can call me directly and leave a message on my phone. And do you want me to get that number?
Well, you know what? We'll get that posted in the feed on where they can go, and a website where they can find more information.
You can call my office and just leave a message, and I'll get back to you, and we'll get things rolling for you.
You'll get right to it. Personal attention. Yeah. Final thoughts. What is there anything that that as we head out on this Friday and head into the weekend, you want us to know?
People don't think that people with Down syndrome have anything to give, but I'm telling you, that's a highlight of my day. And when they smile, it lights up a room, and it's a wonderful thing. They're good folks, and they have issues like everybody else does, but they're wonderful folks, and they can make your day.
Thank you so much. I love all these guests today. Thank you, thank you. Dr. Hawkinson, I just love it when we do stories like this and programs like this, and just and learn something. I learn something every day, whether it be from you or any of our guests, and today just really meant a lot.
Yeah, that's where I was going to go with this. You know, I loved watching that dancing. You did awesome, even though you said you were nervous. You definitely didn't look like it. You know, for this cold weather week, I think we've all had our hearts warmed by the Super Bowl win, the parade, and you know, to end this week off with this story, heartwarming, so great and so awesome. What a great community to be in, and we will keep promoting this clinic, and really just. It's just good to be in this community because of that and everything that's going on.
We'll keep working towards it, and we'll keep learning more.
Yeah.
So thank you to everyone today. And thank you so much for joining us today. We will be back here on Monday at 8 a.m. like always. Have a great weekend. Coming up Monday on the Morning Medical Update, a bride-to-be needed heart surgery. Her wedding plans put on hold, but not for long. I'm Jessica Lovell. Coming up on the next Morning Medical Update, the brand new procedure that not only fixed her heart, it had her out of the hospital in under a day. Join us Monday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now everywhere podcasts are available.